India has kick-started administering booster doses to its frontline workers and elderly with comorbidities as COVID infection rate spikes multifold in the past 2 weeks. With a target population of around 57 million, experts believe the government should be able to inoculate all of them with what it calls the precaution dose in a few weeks. India is once again registering an overwhelming everyday COVID count like it did in its second wave in April and May, but with a far lower severity, hospitalization and mortality rate. A report.
India has started vaccinating its frontline workers and vulnerable elderly as the Omicron variant has fueled nearly 10-fold rise in daily infections in the past 2 weeks. In this new phase, only healthcare personnel, other frontline workers and people over the age of 60 and suffering from other health conditions are eligible for what the government calls a precaution dose. As per the Federal Health Ministry, an estimated 10.5 million healthcare, 19 million frontline workers and 27.5 million comorbid people in the 60-plus age group would be administered the booster.
ये गवर्नमेंट अभी हमारे लिए बहुत अच्छा काम कर रही है। हम सीनियर सिटीजन हैं। पहले दो डोज भी हमको ऐसे ही मिल गए थे इजीली और अभी भी बूस्टर डोज दे रहे हैं।
While a sudden spike in the infected numbers has caused concerns among many, Omicron, a relatively less threatening variant taking over Delta as the most prevalent variant in the country, has provided a sigh of relief across the health spectrum. And with pharma companies putting their weight behind booster dose, Indian authorities too have urged every vulnerable citizen of the country to get himself jabbed. Meanwhile, India's indigenous vaccine developer Bharat Biotech has claimed that the booster dose of Covaxin is effective against both Delta and Omicron. Despite having one of the largest eligible populations to be jabbed, India has out-vaccinated several of the European countries and the USA. The authorities are now ensuring that the vulnerable receive further immunity in their fight against the pandemic.
All the healthcare workers who are involved in the treatment of the corona patients in the hospital who are prone to get the corona infection, it is advocated to take a booster dose or a precautionary dose after the 9 months after the second dose, and we are starting here today and tomorrow. We will give the booster dose for all the healthcare workers, including the doctors, paramedical staff, nurses, house surgeons, PGs, security and sanitary patients.
Although the situation has not become as grim as the second wave, the government of India is claiming to be prepared for a further rise that is predicted to peak in mid-February. The Health Ministry, which has cautioned citizens to be more assertive, has also said the country has also reported a low hospitalization, even lesser than half of what is reported during the second wave. A little over 5% of patients since the first case of Omicron was detected have sought hospitalization, compared with 20% to 23% during the Delta-driven last wave. Authorities in the cities of Delhi and Mumbai and major Indian cities say most people have shown no or only minor symptoms and have recovered quickly at home.
वैक्सीन का बहुत ही बढ़िया इफेक्ट हम देख रहे हैं। इतने सारे केस बढ़ने के बावजूद भी एडमिशन बहुत कम है। हमने भी सुना है, आपने भी सुना होगा कि करीबन 1.5% एडमिशन रेट है। बाकी सारे लोग बोलेंगे कि होम आइसोलेशन में है, और होम आइसोलेशन से एडमिशन होने का भी अभी कोई इतना इंक्रीज ट्रेंड नहीं दिख रहा है। मतलब सारे लोग घर पे ठीक हो रहे हैं, तो ये एक बहुत बड़ी अच्छी बात है।
Apart from a rapid vaccination drive and boosters for its frontline lot, the government is also taking several measures, including the night and weekend curfews, to reduce the speed of the infection. In order to prevent mass gatherings, the Election Commission of India has prohibited large rallies and has urged the political parties to shift their campaigning for 5 poll-bound states to digital platforms. The union and state governments have so far dismissed the idea of a complete lockdown in order to prevent an economic slowdown that had severely hit the market in 2020 and several thousands were rendered jobless. And the intent of the government has been clearly reflected in its strenuous vaccination drive with relentless information campaigns that have kept the per capita infection ratio of the world's second most populous country way below others, which include even the most developed economies.